The news game is very different to academia. We work at a faster pace every day, constantly changing, getting the sound bites, and we all wanted the headlines from you with regards to our behaviour, what was happening in the research, and you managed to get some information out quite quickly. What were your first early findings? Because we said at the very beginning, people were reluctant to wear masks, they weren't sure about the social distancing, they weren't sure about the anti-back at the door, they felt they were being violated with all these rules. So what were the behaviour changes? What were you seeing at the beginning of your study?
I think, in some senses, governments and also many within, I guess, behavioral science underestimated the power of people and individuals to be resilient and to adapt to these unprecedented changes and requests and sacrifices. So, whilst there was this assumption perhaps in the early stages that people wouldn't stick the course and wouldn't continue to be motivated to be locked down, we now find that for the vast majority, they have done more than has been asked of them in many senses. And also with mask wearing, I think there was this assumption that, the science, of course, was a little divided at the start as to whether it would really have a protective effect. I think we can now say with good confidence that it has been enormously helpful. But again, the vast majority of the Welsh and British public have quite quickly adapted to mask wearing. And so it's a reminder, I think, that, as much as we have these kind of behavioral norms and habits, when needed, under the certain circumstances, we can change them. I think, again, that's not to say that people won't be looking forward to going back to the old normal somewhat. But of course, I think some of these behaviors are here to stay.
At the moment, we are seeing turbulent images, aren't we, on screen? We're seeing demonstrations, we're seeing uprisings, and people questioning a little bit more what's being asked of them. Do you think that this has enabled governments to see how far they can go with us, with putting rules in place and putting sort of legislation in place which controls us? Because we've reacted quite positively, I think, to the lockdowns. But we're seeing now, when other policies are being introduced, that people are starting to knee-jerk. Is that because they've been kept in and hemmed in so long that now they're frustrated, and maybe issues which maybe they wouldn't have got fired up about before, they're now starting to spill over?
Yeah, possibly. I think definitely as the pandemic's drawn on, there is, a growing sentiment, understandably, amongst some that a form of rule fatigue is setting in, I guess, where people are really, I suppose in our work, we talk about something called learned helplessness, which is just this idea of, as you mentioned, when control is constantly taken away. And I think the problem with the pandemic, even though to an extent it's been necessary, as we've gone through these cycles of having freedoms taken away, then giving them back again and having them taken away. And there's still uncertainty, really, as much as we can look to these roadmaps. I think a lot of people are not quite sure how to feel at the moment. They're very optimistic, rightly so, about vaccines, but they're also quite concerned about, new variants, and also whether or not June and July will approximate the old normal. So I think people are really confused. And I think having this, control and freedom taken away over time, for some people that turns into a sense of giving up, and that giving up could lead to depression in some people. That giving up in some people could lead to giving up on following the rules and maybe resisting that, and seeing it as an attack on civil liberties. But again, I think the bulk of the evidence does suggest that people are, as much as it's harming them in terms of mental health and stress, they're really doing what needs to be done to stick the course. And again, in research in Wales, we see that up to a quarter of the public are willing to arguably stick lockdown out for another 8 to 10 months. Of course, there's also a significant proportion that feel like they literally couldn't last another month or so. So there is a divided public overall, I'd say.
You're also looking at long COVID and the impact of the actual virus for a number of maybe years, potentially. This could affect people. So what have you got in place? What are you going to be looking for and looking at?
Well, I think we are really looking at it from the perspectives of the people or patients themselves. That's our plan. There's, of course, a lot of really important work being done by medical researchers that will look perhaps more at the symptoms and how they manifest and progress. I think what we are really interested in is how that affects how people feel, how people themselves try and come to terms with this new illness that a year ago none of us knew anything about, or a year ago we knew nothing of. And so for us, it's how does that affect their daily lives, and what some of these symptoms from reported cognitive impairments, that some people are talking about. Maybe they feel like they're unable to concentrate as much as they were, through to ongoing issues with breathing and so on and so forth. So clearly we know for those who do suffer from long COVID, it's having some really challenging impacts on their quality of life, and how they perhaps overcome that, and what treatment and support is needed. And I think the other thing is also looking at ongoing mental health impacts, whether or not that's related to long COVID. We know from past research on outbreaks, whether that's SARS or pandemic flu, that people who were really involved in the front line on those and had to quarantine at the time reported mental health impacts up to 3 years later. And that was a relatively short period of quarantine, a couple of weeks. Many of us on and off have been quarantining for the best part of 12 months. So we have no research precedents for this, but we do know that when the pandemic is officially closed by the World Health Organization, that isn't the end of the problems that coronavirus has created. And of course, there's no vaccine for mental health. So it's important that we get the support in place to really help those affected by it.
A year on from the first cases coming to the UK, and we've learned so much. It's bizarre that our world leaders weren't prepared for this pandemic, because it was always on the register in the top 10 as a potential to happen. Why do you think they got it so wrong?
It's a really good question, and definitely they'd be the ones to answer that. But in my opinion, I think that we should have learned lessons, I think, from a couple of scares of pandemic influenza that many of us remember, 10, 20 years ago. And obviously, as you mentioned, the strategies were in place. I think what took people perhaps by surprise with coronavirus was the rate at which, it transmitted, and the speed of that. But nevertheless, I think this is a lesson that we need going forward. We need to learn from this as a society, and certainly policymakers do, so that if we do have a situation where we have a new novel disease in the future, that we respond more appropriately. And I think, looking at the UK, at least, from our research and that of others, we can draw a few lessons. One is a more joined up approach. I think, the majority of people we speak to find it hard to understand why the UK has not been more cohesive. And of course, also preparedness in the early stages, looking at a more effective test and trace and isolate system, as well as testing capacity. Hopefully, of course, again, the infrastructure that we'll have built as a result of this pandemic will perhaps give us a bit more of an advantage if, and hopefully it won't be in our lifetimes, but if there is another pandemic of this nature.